Hi, I'm Dr. Mike Atkinson, and we are here today in Brookfield Zoo's Animal Hospital, and we wanted to take an opportunity to share with you an update on Layla, one of our eastern black rhinoceroses here at the zoo. As many of you may have seen, Layla had a CT scan performed back on April 19th. This was the first time an adult rhinoceros has ever had a CT scan done. And with the results of that CT scan, we were able to put together some information to help guide our treatment course. Using the data off of that first CT scan, we're able to basically create a three-dimensional model of Layla's head, which you can see here on the computer screen. And what we're really looking for here is to try and understand where this infection that was within her sinuses came from. Once we were able to identify that there was an impacted tooth that was the source of that, we were able to really plan our surgical approach. With the three-dimensional information from a CT scan, we can also make a three-dimensional printout of Layla's head. This model was generously donated to us by Terra Recon, a company that specializes in these types of models. And basically, this is a 80% scale model of Layla's head. And what we're looking at here is basically her nose would be here, her horn would be right up here, and then the back of her head is coming this way. So if you look at the screen here, we're basically looking from about right here to back to about right here. Using this three-dimensional model, we're actually able to take a virtual look inside of Layla's skull to visualize both the abnormal tissue as well as the normal anatomy. We're also able to color code and shade, so in this case we've colored all the abnormal tissue in this green shade. And what this really allows us to do is visualize exactly how extensive the infection is and what structures it's involving. In this case, we can come down here, and these are actually Layla's teeth here that we're looking at, and you can see this last tooth is not erupted out into the normal socket where we would expect to see it, and it's actually this blue shaded area here that we've artificially colored in this blue color. And there were several times during the surgery where our team would actually stop and consult the model and take some measurements, plan some angles, and come back in with our instruments to try and safely get at certain areas to remove infected tissue while preserving the normal structures. On May 7th, our team went back into surgery with Layla in an effort to remove the infected tooth that we're able to see on the CT scan. We were joined by paraveterinary surgeons from North Carolina State University, as well as Dr. Chris Downs, a local equine surgeon here in the Chicagoland area. Our goals for the surgery were both to remove the infected tooth as well as all this other infected tissue within her sinuses. And one of the ways that we do that is through a sinusotomy incision, which is what you're looking at right here. And this is actually a hole that we've cut through the outside of Layla's skull to allow us access down into this sinus. And this tissue will heal up completely normal once the problem's resolved. This area will close back in with no concerns, but it gives us an access route down into that sinus where we can remove the infected tissue out of the area. It was a very long surgical procedure, but we were able to remove the majority of the infected tooth out of Layla's head, as well as a fair amount of the infected tissue within her sinuses. On May 15th, we performed a second CT scan on Layla using a BodyTom, a portable CT scanner that was graciously donated by Neurologica, a subsidiary of Samsung and Sound Technologies. Using this second CT scan, we were able to map out exactly where the remaining infected tissue existed within Layla's sinuses, and we've performed a couple of follow-up procedures since then to try and remove the additional tissue that's still causing us some problems. At this point, Layla is comfortable, she's breathing very well, but we do still have a long road ahead of us in terms of getting her back to normal. We're confident using this advanced technology that we'll be able to continue to make progress in completely resolving this infection. At this time, Layla remains behind the scenes at our pachyderm building to give her some quiet time to rest and recuperate from these procedures. However, we have gotten the warm wishes and get well cards from many of you, and from the bottom of our heart here at Brookfield Zoo, we'd like to thank all of you for keeping Layla in your thoughts, and we hope to see you out here soon this summer.